Hi, I'm Melissa Vance with the Wayne County Area Chamber of Commerce, and I welcome you to Chamber Chat. This is a special edition where we will be talking about the current coronavirus issues right here in Wayne County. We'll be speaking today with Craig Kenyon from Reed Health and Christine Stinson from the Health Department, as well as one of our small businesses. Thank you for tuning in. Again, thank you for joining us for Chamber Chat this evening, and I am pleased to have with me Craig Kenyon from Reed Health and Christine Stinson from the Wayne County Health Department. Thank you both for taking time out of your incredibly busy schedules right now to talk with us.
Thank you.
We know that our community has a lot of questions about what's going on, and hopefully we can put some of those questions to bed and instill a sense of peace for our community with some actionable items along the way. So, Christine, let's start with you.
Sure.
I know you have a task force that's been put together specifically for the coronavirus and the current issues. Tell us what that task force looks like. How often are you meeting?
Mm-hmm.
What's the overall purpose?
Right. Well, it's to make sure that we have situational awareness in the community with our largest healthcare provider, which is Reed Hospital. And we meet weekly, and that's myself, Dr. Jetmore, who is the health officer for Wayne County. We have Dr. Huth, and I don't know the names of I'm so new here that we have an the infectious disease coordinator and their emergency response from the ER also attends these meetings. Our emergency preparedness coordinator, Dan Burke, also attends the meetings.
Great. Christine, I know yesterday we heard from Governor about the closure of bars and restaurants for inside dining, excluding the curbside pickup.
Yeah.
And then today we heard from our mayor and commissioners that we are under a level 2 travel emergency here in Wayne County. Explain what that means.
Well, everything that's being implemented, whether it's from the CDC or the State Department of Health or Governor Holcomb's office or our local leaders in the health department, are meant to promote the social isolation that we're asking people to do. This is a novel virus. So when we look at different diseases that come in and out of our community, even the annual flu, we have vaccines that we give people, and you start to develop a herd immunity in your community. We have none of that with this novel COVID-19. So the best way for us to combat the epidemic, we're going to see cases in Wayne County, is to socially isolate and social distancing. So the closures of restaurants where people gather and sit down and eat together is something that we've asked the restaurants and bars to stop, and to go to curbside pickup only, which means they don't come in and order their food and pick it up. That the establishment goes to the car, and it's more like a car hop.
Sure.
Back the way they did even before I was born.
Yes.
So all of these are meant to promote the social isolation that we need to get a handle on, to stop and slow down the spread of the virus in the Wayne County community. So
this level 2 travel emergency doesn't exclude people from going to work. They can still go to work and to the grocery.
Correct.
But no non-essential travel.
No non-essential travel. And we are encouraging employers to look at their workforce and their work staff and see who could telecommute, and promoting those kind of work activities to where we're getting social isolation even at work.
Sure.
So can we separate out workspaces to where we are getting that 6 feet in between each other, and if they can work at home, have them work at home. We want as many people staying home through this particular part of the virus to stay home. That's what we want to promote.
Absolutely. Craig, you're not only dealing with this influx of patients at the hospital, but talk about what's happening in your physician offices. I know Reed physicians have offices throughout the region, not just Wayne County, but the entire region. What are you seeing in those offices, and what's that been like?
Sure, we get into the same kind of a thing with the travel restrictions, what non-essential visits need to take place now. Not that the visits themselves aren't important, but that they need to take place right now. So well visits. A well visit is where the patient has no symptoms, they're coming in for their annual checkup. Maybe we should move that to May or June, somewhere further down the line. Or a person's coming in for their annual recheck of some chronic issue, or just making sure everything's okay. It's another sort of a well visit, but it's based upon some underlying problem that we're following. Maybe right now is not a good time for that either. Let's phone triage you. Let's talk about, is everything okay? Does anything right now bothering you, or can we wait a few weeks and reschedule you? And so pushing things further down the line to prevent the surge, getting too many people interacting all at once, and cross-contaminations of people that come into the office, and potential cross-contaminations from patient to healthcare worker.
You started some digital versions of physician visits a while ago. Are you seeing more and more people using that option?
It has been very slow in coming on board, which has been a little bit of a surprise to us. But things like this could change this particular application, and likely other things in the world as well. But it really is working like Skype or FaceTime. And I think some people may think it's a version of another digital chat.
Right.
But you're actually face-to-face with a healthcare worker. So it's called Read Health Now. That's the app. You can go to the App Store and download it. It's for the app itself is no charge, so it's a free app. And the app has two choices. It could be right now a special screening for coronavirus.
Oh, great.
And that is a no-charge screening option. You're interviewed face-to-face over the app with a RN who will go through just kind of a screening visit to see what's exactly going on, what types of symptoms you're having, have you had any temperatures, have you checked that, and so forth, to see if there's really any reason for you to be coming in further to the health system. I think people want peace of mind. And also some people are tough people. They want to tough it out. And we might say to them, what you're saying is happening to you right now, we're concerned about your airway and your breathing. We need to see you. So let's schedule to get you in. Let's work how we're going to do that.
Sure.
So we don't know exactly what's going on. It could be a possible coronavirus infection, but we also have seasonal flu. That friend is still here and coming around, will be around again next year. And so we will continue to see how we can take some of the velocity out of the healthcare visits for the moment.
Great. And then from the hospital side, tell the viewers, what precautions have you already implemented? What does that look like? And when is it appropriate for them to go to the emergency room instead of making a phone call?
Sure. So visitors into the organization to support loved ones. That was a tough decision, but a necessary decision to ask them to not come in. You could still phone call, and if your family member has an iPhone or another phone to Google or do FaceTime with,
Sure.
you could do the same thing, except you're not exposing yourself or them to whatever might be going on out in the community. So practical solutions, what's the next best thing to being there? And screening out people who are visitors was one step. The other is also with the directive from the governor to reduce elective procedures. So if it doesn't need to be done now, can we wait on that? And that's a decision between the doctor and the patient based on what exactly is going on. And the physician will make that decision. The physician will talk with the patient and say, look, we could really wait another 30 days on this and we'll be fine. Or,
Right.
I know you heard about elective procedures being deferred, but we're not going to defer yours.
Right.
So those discussions will be taking place right now and talking about those.
That could be a knee replacement or just things that are scheduled out.
Yes,
Something like
without
that.
putting the patient in danger
Sure.
for a period of time.
Sure. Okay. So turning the channel a little bit from actual healthcare, but looking at your workforce. Obviously, you're in a vital workforce for our community at this time. How are you seeing your clinical staff and others affected by school closures and some of the restrictions that are happening in our community? And what measures are you taking to help address those?
Sure, it's a great question because their vocation is one thing and they have families as well with all the support you need for a family. So that has created a lot of extra anxiety for everybody in the workforce now. We know healthcare brings its own set of issues, but this is a generic issue. Child cares are also closing for all the reasons that we would anticipate, the interactions and the cross-contaminations and that surge issue.
Right.
There's a reason for doing that. Then the practical issue from a healthcare worker perspective is we're still 7 days a week, 24 hours a day. So we need people, and you have to find some solution for the care of your child with the schools closed. So we're looking at different options. We're looking at what Reed might be able to do to supplement where there is no other option for that particular care worker and their family. So we're evaluating those. There's some risks with that because we could unintentionally create interactions within our own set of individuals there. So we're going to
Sure.
approach this very carefully.
I know, just for example, when I lived in Texas away from my family, if school closed, I was out of work because I didn't have family that could help out. And there are people in that situation here. Obviously, if people have other options with family or close friends to help care for their children, it's better just to start looking and finding those options on their own instead of looking at a provider for helping with that.
Yes, absolutely.
So I know, Craig, you've had to close your facility in Franklin County temporarily due to a presumptive positive in Franklin County. What does that look like currently, and how long do you anticipate that being closed? Do you anticipate other facilities also needing to be closed?
Sure, and this is obviously a big issue from the standpoint of access to health care in Franklin County because there's a limited number of providers, us being one of them. And so we're right now working to see how we can bring the office back online faster, even though it may take a full 14 days for those healthcare workers to be quarantined to see that they are in fact safe before they return.
Sure.
We're evaluating all options and what we can do and see that. So I think our Read Health Now app could be really a good gap filler for some people in the
Right.
Franklin County, Brookville area.
Great. And then as other potential positives occur, will that have to happen at each one of the facilities where that might take place if someone would go into that office?
Yes, and part of that comes to the fact that can we stand to have that exposure replicate, because if this happens with any kind of velocity, we'll have shut down everything.
Right.
So we have to go to more protective measures. People need to call, not come into the office, maybe just park in the parking lot, stay in their car, and we go out and screen them with somebody who has proper protective equipment on, that if there's an exposure, they're protected and they can come back and continue to do their job. But if they aren't well enough to come into the office and we evaluate them at carside, we can direct them to what steps need to take place next without coming in and spreading potentially the virus to other people in the office, whether those are patients waiting or the staff or the physician.
Absolutely.
It's important for the public to remember that even if they do get the COVID-19, 80% of people will experience very mild symptoms, and they will be able to stay home, they will rest, they will drink plenty of fluids, and they will stay home. And stay home. I can't stress that enough, that we want people to stay home if they're sick. And right now, really, it's not essential travel. And if you don't need to go out, stay home so we can reduce that surge down.
One of the questions that I've heard just in the past day or so is, this is seasonal allergy time.
Yeah.
So Christine, tell us, how does someone determine the difference between, I have seasonal allergies, I have the flu, I have coronavirus?
Well, and that's really for a medical person to answer that, but there are signs and symptoms. We do find, and another reason why we're asking people to stay home during this 2 weeks to reduce that surge is so many people are asymptomatic.
Sure.
But typically there is a fever, there is a cough, and there's fatigue, and possibly a headache.
Okay.
So those are the ones. But if you can stay home and just relax, rest, drink plenty of fluids, stay in contact with your provider, that's how we want people to handle this virus and not overwhelm our healthcare system. Younger people are going to be more likely to have very mild symptoms to this and not need any kind of doctor care through it.
Great. Well, thank you both for being with me, for taking time out of your busy schedules to come and talk to us. And thank you for being great leaders through this process that we've never experienced before, at least that I recall. I'm sure it's happened in the past, but we have great first responders. We have great medical personnel here, and Wayne County's in good hands. So thank you both.
Thank you.
Thank you.
We'll be right back with our next guest. Stay tuned.
Hi, how can I help you?
My daughter has a fever and she isn't feeling well.
Okay, let's get her feeling better.
Receive quality care within the comfort of your own home. Read Health Now, right beside you.
Welcome back. Thank you again for being with us, and it's my pleasure now to introduce the owners of Cordial Quark here in the Depot District of Richmond, Adam and Becky Melton.
Hello.
Thank you both for being here.
Yeah, thank you for having us.
Your establishment is not only one of my favorite in this community, but everybody I hear loves coming into your place.
Good.
Thank you.
Whether it's for a glass of wine or dinner or brunch on the weekends,
Right.
or to get an amazing cupcake. Just saying.
Right.
There are so many good things to be had there. So
Thank you.
We have a very supportive community.
Yep.
yes, hopefully you are enjoying your location and
We are, very much.
Good.
Very much. Yeah.
so you've been in business now for how long?
2 years.
We just hit our 2-year mark.
Wow.
10 days ago, something
Yeah.
like 11 days ago.
It doesn't seem
Yeah.
like it's been 2 years since
No,
we got that
no.
ribbon.
No, and it feels like a lifetime ago at the same time.
Right,
So much has
right.
changed in that 2 years, but it's flown.
Right.
I'm sure.
Yeah.
Your staff, you have a great staff.
Thank you.
So
Thank you.
friendly. You've trained
We
them
know
well.
we're lucky there.
Yeah.
Yeah.
Yep.
Well, you can tell that there's just a great culture among you. So
Yeah. Yeah. We preach that even internally, that not only cordial to our customers, but we have to be cordial to each other.
yes.
So that we all get along and everybody enjoys coming to work.
They all refer
Good.
to it as the Cork fam.
Yeah.
Aw, I love that.
Yeah.
Well, we've been talking on this show today, and the community is talking nonstop about what's going on with the existing coronavirus epidemic. talk to me a little bit about what you are doing currently or have been doing and how your business model is changing for, just to be fluid in these turbulent times.
Right. I mean, Sunday night we're all sitting around the table and with family and just talking about Ohio and Illinois shutting down restaurants, and we just started thinking, man, when is this going to happen to Indiana? So we almost started preparing ourselves mentally to start making some of those changes at that point. And then when it came out Monday morning, it got real fast. So
Yeah, we didn't know, being
Right.
right here on the line, that state line, whether to expect an influx of people from Ohio who can't go out to eat in Ohio coming
Right.
over, or to be shut down completely like they are. So
Right.
we were moment by moment just waiting to see what was going to happen.
yeah.
Sure.
So I mean, as of right now, I don't know if things can change too much more at this point, being shut down. But we've been working nonstop to offer curbside service.
Great.
We can still do wine carry out. People are allowed to be in the establishment as long as they're not congregating, waiting, standing, sitting, dining, all that
Okay.
stuff. So
Okay.
if they come into the establishment to pick up their order, they can carry out a bottle of wine. We're also gonna try our hand at delivery
Okay.
starting later this afternoon. We're still
Great.
working out the kinks.
We hope
so,
people will be very
yeah.
patient with us as we figure this out, because
Right.
it's very new to us,
Sure.
like our
Right.
staff.
Something that
Sure.
something that would normally take months of planning, and
Mm-hmm.
we've hunkered down
We're
and
winging
are
it.
trying to pull this off in about 18 hours.
Great.
So,
So what will your delivery radius look like?
right now, starting out, we're looking at about a 4-mile radius.
Okay.
Which takes us, almost to the edge of town on the north side, Beeler Road on the south,
State line on,
State Line and Round Barn.
yeah.
Okay.
So that's what we're looking at right now, just to kind of see how things go and how it works out. And, I'm also trying to read up on all the laws on delivery and wages that you
Right.
have to pay. And I mean, all of that,
Right.
all that stuff is new to me. Of course, laws change all the time, so I'm always trying to brush up on things.
Absolutely.
So this is just another one of those things, and now there's a timeline put on it, so.
Well, one of the things that we've been trying to share with small business owners is that through the SBA, there are dollars that hopefully will be coming to help
Right.
support small businesses,
Yeah.
but we need small businesses to go on and actually register their
Okay.
either
what
existing
we're talking
losses or
about.
projected losses within the next few days,
Yeah.
so that enough dollars funnel here to
Right.
help folks. So if you're out there and you are a small business, please go to our website. You'll find the link there. You can go to the Small Business Development Corporation website, or probably even the EDC website. I know they've been sharing that message, but let's make sure we get those dollars flowing to Wayne County and helping out our small businesses. And I encourage you as our listeners to support these restaurants. Non-essential travel, as we heard earlier today, is including the pickup or delivery of food. So you can still do curbside pickup, you just can't congregate. And please go to the Cordial Quark
Right.
website to order or give you a call.
Call us,
Phone
yeah.
call, yeah.
Give them a call and place your order, or stop by and pick something up. Reach out to all of the small businesses and the small restaurants during
absolutely.
this time. And then for you small businesses that are out there, one last reminder that I wanted to share is that the Chamber is trying to be fluid during these times and help you as you are addressing needs that you never thought you'd have to address. We are setting up a weekly phone call called the Think Tank, Encouragement and Support During Difficult Times, and that will happen on Tuesday afternoons. You can find all the information on our Facebook page. There is an event with a link. It will be a Zoom call, so you won't have to be in person, but this is a way that we can support each other during this time. So please check that out. And for the community, Please follow the restrictions. Let's get through this as quickly as possible. Again, thank you for tuning in. Thank you for Adam and Becky for being with me today and for all that you do for the community. We greatly appreciate you.
Thank you.